Hello, everybody. Thank you for joining today's webinar. This is Matthew Klinsky, and I have some great experts today to talk about credentialing compliance as well as OSHA and HIPAA compliance. So thank you again for joining the Doctors Management Group Simplifying the Business of Medicine webinar series. This is a monthly webinar. We talk through different challenges for physician owners, and we are currently in our third of four webinar series called the Startup Series. So this series is designed for physicians, providers, or any level of provider who is looking to start up their medical practice or who is thinking about starting up their medical practice in the next few months or years. This is not really designed for if you have a running practice and you're already taking some of these challenges, but feel free to stay and watch our presentation today. So let's go ahead and jump into it. Let me share my screen. Perfect. So quick, we'll do some introductions and I'll introduce myself first. Again, my name is Matthew Klinsky. I'm a physician trained in internal medicine pediatrics. I have a history of being an entrepreneur, worked as a physician for 10 years, and I've been consulting with Doctors Management Group for over 2 years now. I'm currently a senior management consultant. We work with practices of all sizes, primarily in the private practice space, everything from startup all the way to exits and everything in between. Love working with practices throughout the country, including primary care as well as all the subspecialties. So thank you again for joining. I'm co-sponsors today or co-presenters today. We have Dawn Wood and Shannon Moore. Both of these fine, excellent teachers are part of our director leadership team at Doctors Management Group. Dawn is our director of credentialing services and Shannon is the director of OSHA HIPAA. So if you, before we jump into it, I'm going to have them talk a little bit about themselves and give you a little bit of story of why, what they're doing in terms of doctors management, as well as what they're going to be talking about today. So Dawn, if you don't mind giving a little story about yourself.
Oh, good afternoon. I apologize. There is no video, but my camera is not cooperating.
Okay.
I am Dawn Wood. I'm the Director of Credentialing. I have been with Doctors Management since 1999 and been the Director of Credentialing since 2012. As I have taken over the department, it has gone from kind of a floundering department to a successful department, and we pride ourselves in our work and the quality of the work that we do and getting our physicians onboarded as quickly as we possibly can.
Yes. Yes. All of my startups love your team, Dawn. They're just excellent at getting the job done as quickly as possible. So thank you for joining. On the other side, we have Shannon Moore. Shannon, if you don't mind saying a few words.
Absolutely. Thanks so much for having me. I'm the director of OSHA HIPAA compliance with Doctors Management, and I've been with Doctors Management a little over 5 years. My role has changed a couple of times in the organization, but with OSHA HIPAA, one of my favorite components is working with startups and really existing practices. Oftentimes when someone new steps into the role, that has been designated as that safety coordinator for OSHA or that privacy officer for HIPAA, and just taking the fear out of all of the regulations that exist really behind the scenes, and staying on top of that. So that's been one of my biggest joys working with OSHA HIPAA clients. I'm really helping develop a compliance program that not only sets a really good foundation for you from the start, but then eventually has a routine cadence that sets you up for success down the future.
Yes. Perfect. Thank you so much, Shannon and Dawn, for joining. So as I mentioned, this is the webinar series for startups. We already talked a little bit about that. And it's always important when you're doing a webinar or education, of all sorts, is really the why. And at Doctors Management, we really care about the private practice sector of medical practices, and the situation is changing. So in the 1980s, private practice ownership or physicians in ownership was about 76% of all practices. Fast forward to 2024, we're seeing less than 50%, almost 40% of practices are physician as ownership stakes. And we're trying to change that. We're trying to make sure that when you are a physician and you have the opportunity to own a practice, that you continue to thrive in that practice and maximize, all aspects of the practice. So today we have a great agenda, as I talked a little bit about. We're going to focus it broken down into 4 key components. The first 2 will be on the credentialing side of the house, what you need to know from an ownership standpoint, as well as the best practices. And then the second 2 points, we'll turn it from Dawn back over to Shannon, and we'll talk about OSHA and HIPAA compliance for owners, as well as the best practices responses to incidents. So without further ado, we'll jump into it. And Dawn, if you don't mind talking through those credentialing overview for the practice owners. And Dawn, you're on mute.
Thank you, Matt. Most of our providers are coming from a position where they have been credentialed under a hospital or credentialed under a private practice previously, and someone else has done that process for them. So the process is a little overwhelming is the best word that I can think of for a lot of providers. There are a lot of things that go into starting up your own practice. Some of the things that we would need would come from working with the consultants and helping get things, the business articles and EIN set up for the group. And then we have to go through, even if the provider's been provided or credentialed in a particular state, there's another layer of credentialing that we have to do to get them credentialed under their private practice. To start with the first bullet point, why credential? We want to credential because we want to get paid, basically.
Absolutely.
If we do not credential and contract with those payers, the practice will not be able to see patients in network with those specific payers. And unless, of course, the patient may have some out of network benefits, but we're going to be able to see a bigger patient base if we do credential and contract.
So as a provider is setting up their own practice, they have to start thinking about how are they going to generate their revenue, right? And
correct.
So as long as they're taking money from any payers, they're going to have to get credentialed with that payer to be approved, right?
Right. And the credentialing process is basically a process that the insurance companies go through that vet the provider to make sure that the provider is actually a qualified provider, that they are who they say that they are, that they do have the work experience and certifications and medical licenses that they say they do. We want to make sure that we don't have any one who is possibly impersonating a physician sliding through the cracks with any of the payers, because the payers are obligated to protect their patients base. So that is one of the big whys they do it. The typical process and timeline is, because of primary source verification, is 90 to 120 days. And that does seem like a long time period for most people. However, once that application is submitted back to the payer has a team on their side that goes back to every state medical board, every insurance carrier, every medical school, every fellowship, every residency, and they get a letter of verification stating that the provider did go to their specific program during the time that they say that they did. Once that is completed, then we can move on to the second part, which is going to be the contracting process. But
So talk a little bit, Don, on primary source verification, because maybe some of our providers have filled out those documents in the past and they handed it to the hospital, or they were part of a residency program and they did it for them. But what is primary source verification, and maybe what kind of questions should they be prepared for to answer or on the application to kind of gather those documents?
The most important thing is to make sure that the information that you are providing is accurate. What dates did you go to medical school? Month,
Hmm.
year, with a graduation date, with the full date, not just
Yep.
kind of a guesstimate. Because what that team is going to do is they're going to go back to possibly that university and say, I have Dr. Jones, and he states that he graduated from your medical school in January of 2022, and this is his
Right.
graduation date. And if that doesn't if that doesn't line up, that's going to throw a red flag,
Now that's
which
the
is
challenge, right?
which is going to cause a delay
Yep.
in getting that application processed. And our goal is going to be to try to get that application processed as quickly as we possibly can with no delays caused by anything that we submit on our side. We
Yeah,
we
and the
want to
90
be
days starts after they have the business, right? They need a place to operate
yes.
and kind of some other confirmation. What else do they need from a business standpoint besides the address?
We request that they have the address, a phone and fax number.
Hmm.
I know a lot of our newer practices are not interested in getting a fax number, but you would
Right.
be surprised at how many of these medical entities still want to send information by
Yeah.
fax because it's more secure than email.
Yep.
A lot of them are going to secure email portals, but many of them still work using a fax. And that
Hmm.
goes for your claims denials as well. I've had several practices that are still receiving their claims denials or information of that nature, prior authorizations and other things by fax.
Yep.
So
Yep.
even though it seems a little antiquated, they're
Yep.
still they're still expecting it. We want to have of course, your tax ID and what kind of entity you are. Are you an
Mhm.
LLC? Are you a corporation? Are you a professional corporation? We need to know that because we're going to be have looking at sending a W-9 to every payer with every request that we submit.
Yeah.
So
So
we
they need
want
to kind of talk with their CPA to figure that tax strategy out. They need to get registered with the state
right.
as a legal entity. And
Yeah, normally falls under your articles of organization,
yeah,
which is
yeah,
what you file to the Secretary of State.
yeah.
Um, Insurance,
So
malpractice insurance.
yeah, yeah, that's another big one.
Yeah.
Let's talk
Uh,
about initial credentialing versus ongoing. How do you think about the two processes?
Um, the initial credentialing is basically um, hurry up and get started and
Mhm.
and get as much done as you can. We're working with 8 to 10, maybe up to 15 different payers, depending on what the provider wants. And
Mhm.
so it's a lot to get out that many applications and get it pushed out
Mhm.
to the payers and then follow up.
Mhm.
On maintenance, it falls more into all the payers are different. We're going to look at some of them require recredentialing every 3 years. Some of them require recredentialing every 5 years. Some of them it's
Okay.
every year.
Okay.
So it's not as big of a project once the initial credentialing is completed. We're going to be making sure CAQH files are attested and kept up to
Data.
date. We're going to make sure that we're keeping our malpractice current and our licenses current and our DEAs and all
Yep.
that. Along with that, we will also have every 3 months directory verifications are required now.
Oh, okay.
So
Yep.
we're going to make sure that all of our locations and all of our providers are listed where they're supposed to be listed
Nice.
and that type of thing. So it's a little bit easier, I guess, is to com- keep the maintenance up to date than that big initial push
Yep.
with the onboarding.
Yep. I've had a couple of practices who were doing the managing the credentialing themselves, but they didn't respond to letters in a timely fashion. They started getting kicked off of their payers. I think that's the biggest risk, right? On the ongoing maintenance, you just have to be responsive to the payers when they need more information.
Yes, and a lot of that falls back into keeping CAQH updated because I would say probably 60 to 70% of our payers are going to go pull that CAQH file for
Yep.
revalidation.
First thing.
So, yeah.
All right, let's talk about topic 2, credentialing compliance and best practices. So, what are your top 5 keys to successful credentialing, Don?
Start early. We recommend, if we can possibly, we want to start 6 months prior to the practice start date because we want to have plenty of time to finish that credentialing process and then finish up the contracting process, which could
Yeah.
take as long. So we want to make sure we have time to get those contracts in place and ready to go when you open your doors. Number 2, complete all requested information and fields accurately. If it's kind of like a computer, garbage in, garbage out. If you don't submit the right information or the correct information, then it's going to cause delays. And that 90 to 120 days can easily turn into a much longer period. We want to respond quickly to any requests for additional information. Some of the payers only give you 3 to 5 days to respond to
wow.
their request. And if you do not respond, they're going to close your application and then you're starting from scratch,
Okay.
which nobody wants to do.
No.
We suggest follow-ups regularly. We don't suggest sending an application over to a payer and just presuming that it's processing and everything's fine. We want to call every 10 to 14 days to make sure where that application is. Is it on somebody's desk? Have they asked for something and maybe we didn't receive the notice? We want to be proactive so that we can get that application pushed through and approved as quickly as possible. The last one is reviewing the agreements. That's kind of part of the second part of the credentialing and contracting process. We want to look at those and make sure that we agree with the rates that they're offering. We want to look and make sure that we agree with the terms of the contract, the terms for terminating the contract if we're not happy at some point with our relationship with the payer. We also want to make sure that they can't just terminate us for no reason. So we want to look at all the different um,
Yeah,
sections
the
and make sure
legal speak.
the legal stuff and make sure and so and it might be a good idea sometimes to have a lawyer look at that
Yeah.
and make sure that you're not obligating yourself to something that you can't provide.
Okay.
So, but those are the
All
top
right.
things.
All right. And then the last one before we jump over to OSHA HIPAA, let's talk kind of what does it look like for compliance in terms of documents and storage and kind of ongoing things.
Well, first of all, you want to make sure you have a secure place that you are saving your information for your providers because it is, and Shannon's going to speak more to OSHA HIPAA, but it's not necessarily doesn't fall under OSHA HIPAA, but we are protecting their information. We use a lot of very private information that can be um, used for
Use
nefarious
and abuse.
purposes.
Yeah.
Yes. So we want to make sure that we have a way to save those documents and that information safely. We want to make sure that the payers and plans that the practice are participating with are understood because just because you participate with United Healthcare does not mean that you participate with every network under that umbrella. So you need to let your staff know exactly which plans you are participating with so you can educate your patients correctly when they come in and present. Um, we want to follow the rules and regulations on mid-level provider credentialing and billing. Um, some of our practices choose to let those mid-levels work incident to, but there are guidelines along with that. You want to make sure that you are adhering to those guidelines so that you don't get into any trouble down the road. Um, understanding
Yeah.
out of, oh,
What
go
most
ahead.
people don't understand is that each payer kind of has some potentially different rules
Correct.
on their own agreements with you as the primary credentialed entity or provider. And so you want to make sure that you do read that section because every payer may be a little bit different.
And you have to be careful too, like Georgia, Blue Cross Blue Shield. One, when I first started, they did not credential mid-levels. They billed
Mm.
under the supervising, and then they
Oh,
changed it,
wow.
and then they did bill independently, and then they
Okay.
changed it back, and then
Oh, boy.
now they've come back and they bill independently. So you have to
Okay.
kind of stay on top of things of that
Sure.
nature.
Sure.
Um, Understanding out of network versus in network. Um, we want to understand that because we want to know what we're able to potentially charge the patient. If you're in network, it's going to be a copay, and then you can't go back and ask for anything else that's not covered under the contracted rate. But if they have out of network benefits that you're using, that changes. You're able
Yeah.
to bill the patient any difference in what the payer may have reimbursed you.
Yeah.
So
Yeah. So it's more of a on the billing side, but got to know what you're credentialing with, and then you can make sure the billing team is doing their part correctly.
exactly.
All right. Thank you so much, Don.
You're more
All right,
than
let's move
welcome.
over to topic 3, OSHA HIPAA compliance for owners. So Shannon, talk to us about OSHA compliance first. What is it, and what should the practice know about it?
Well, first of all, OSHA compliance is strictly about your employee and staff safety and creating a healthy work environment for them. And under OSHA, that is strictly the employer's responsibility. Um, Everyone falls under federal OSHA, but there are a number of state approved plans as well. So staying on top of those additional regulations. I do tell practices that it's really unlikely for you to have a federal OSHA inspection unless you've had a high number of injuries, or it could be a employee complaint or referral. But
Mhm.
let's use Tennessee as a great example. That's where I'm based out of. And I work with a large number of local medical and dental offices, particularly dental in this area, because we have a Tennessee state approved plan. And it is very likely that you would have a TOSHA inspection for those dental
Mm.
practices because they tend to have a high injury rate when it comes to
Mm.
needle sticks.
Okay.
So, first of all, being aware of what those governing bodies are and following the rules and regulations under each of those and any additional ones should you have a state approved plan. Everyone is required to have an OSHA policy and procedure manual. There are a number of plans that must be in a written format. There are some exposure plans or fire safety, certain policies that can be communicated verbally. However, they're all conditional. And so we really want to address what your written plans have to be versus those that are conditional or when there's an exception with those. But you are required to have a handbook on site that's accessible to staff at all times so that they can access the information that you've created as an organization. Um, Reporting workplace injuries. This is a good one. Workplace injuries, medical and dental practices actually fall under a certain exemption group under OSHA. But oftentimes I do run into a total misconception that that means that needle sticks do not have to be reported because they fall under that exemption.
Okay.
And because of the bloodborne pathogen exposure control plan and because of the Needle Stick Safety Act, those are not exempt. And so they must always be reported.
Okay. All right.
Yeah.
Good to know.
Ensuring ongoing safety of employees, training really is the most critical component of that. New employees should be trained within 10 days of their hire date. So OSHA is pretty strict when it comes to that. And again, we want to think about an employer's responsibility to provide that. And so we really want to address several onboarding steps that need to take place, documentation and record keeping requirements, especially when hiring new employees. You need to establish what that employee's exposure risks are, document those routinely should there be any changes, staying on top of what the retention requirements of certain records are.
Documents, yeah.
And OSHA doesn't make it easy. There are some record keeping requirements that can be 3 years, 5 years. And what normally blows people away is that you must keep your safety data sheets for 30 years. And so it sounds almost absurd, but again, there are a number of, components that go into that, and training really is key. And I do see my most successful practices when they're implementing their compliance plans and programs. It really starts with leadership. OSHA's not fun. But it's more than checking the box and saying we did it. So when you have leadership that really expresses their desire to invest in a safe environment for their employees, really communicate that, hey, we do this because we have to, but we also do this because we care about you. Those are definitely the most successful plans that I see.
Yeah.
Yeah.
Now, everybody has heard of HIPAA. They might not have heard of OSHA, but let's kind of shift to HIPAA. I know oftentimes, at least in our organization, it's OSHA, HIPAA compliance. It's kind of grouped together, but they're really different. So talk about the difference and maybe about the difference in compliance related to HIPAA.
Absolutely. So, OSHA, I mentioned it's strictly about your employee safety. It has nothing to do with patient care, whereas HIPAA is strictly about your patient's privacy. Talking a little bit about those training requirements, one of the biggest differences right now is OSHA requires that initial training within 10 days and then requires annual refresher training. HIPAA also requires initial training, but right now their annual training is not required, it's only recommended. But HIPAA is starting to change, and that is because the healthcare sector is being so heavily targeted in ransomware and cybersecurity. We're going so technology based, and that security rule of HIPAA is really about electronic patient health information. So there are a number of standards and rules that are in place to protect that privacy from emails, encryption, password protection. And again, there are some really important components to set that up for employees when they're onboarded to make sure that you are training those employees properly, putting certain administrative, technical, and physical safeguards in place that employees understand to ultimately protect that patient's health information and their privacy. Authorizations are needed for any type of disclosure that falls outside of treatment, payment, or healthcare operations. So again, a policy and procedure manual, having the correct authorization set up from the beginning for a startup is really critical. Having those forms that you can load into your EHR or your EMR so that you have that critical information. Dawn touched on faxes earlier. And again, I like to joke, I can't wait to get away from faxes. But one of our forms we have in our toolkit is a fax information form. And again, it's to make sure that you're gathering the correct information from a patient. But it's also a safeguard to make sure that you're not sending that somewhere that it should not go. So, we create those. Same thing with a confidentiality statement that goes into maybe your signature line of an email. Because again, you really want to communicate that your priority is protecting that information, that you're not making improper disclosures, and that you give a sense of trust and security that you're building with your patients when you're doing that. Requirements of vendors is listed here. This is really important. So doctors management, we are considered a business associate. And so that is because in the work that we do with our clients, it's very likely that we might be exposed to some type of patient health information. And business associates are held under the same rules and regulations of HIPAA that a covered entity is held under. But a covered entity has an enormous responsibility to make sure that you are in agreement with those third-party vendors that might have access to PHI, that they are putting the same type of safeguards in place that you are. And should there be some type of breach or inadvertent disclosure, that they are reporting that back to you as a covered entity. Um, I'll use an example really quickly. A number of our clients were recently affected by the third-party breach of TriZetto. And that TriZetto breach, they offer a number of security programs for you to be able to opt in that really helps take some of that burden off of the practice for notifying each and every one of those patients. When more than 500 individuals are affected, a notice must be placed on your website. A report must be made to Health and Human Services. There also has to be a media report so that there is notification made to patients. And we've had a couple of clients that never realized, oh, I also have to report that breach. And you do. That is an obligation of yours, that it's not your breach, but it's one of your business associates. And we have had a couple of clients have the Department of Health and Human Services reach out to even clarify some of those dates. And one of the things that they're going to ask is, do you have a business associate agreement with that vendor? And are those agreements kept up to date? So it still has a trickle down effect. And it's really important to make sure that you have all of those policies, procedures, agreements in place and well documented.
So for the physicians and nurse practitioners looking to start a practice,
Yeah.
what would be kind of the big things that they need to cover as the startup process for HIPAA?
So honestly, it's huge, and I know we don't have a lot of time left, but
We have
you
2 hours, right? This is a 2 hour webinar.
and I will tell you, when I meet with my clients for the first time to go through those kits, I've learned, because there does have a little bit of a deer in the headlights look. It gets really overwhelming really quickly. So we tend to work through that OSHA kit for a good hour, and then we take a good breath, and then we do HIPAA on a different date for a different hour and try not to combine them because it is a lot. But, really on the OSHA side, putting policy and procedures in place, setting up your written programs, making sure that you're doing required training. Documentation, again, is key. If you don't document it, it might not as well have happened. And then really workplace readiness with some things that sound really even minor on OSHA, but can really ding you. Making sure that you have a first aid kit for your staff. Fire extinguishers are mounted in it and inspected. Sharps containers are available, and that you've got your biohazard waste process established. Eye wash stations. If you use any type of corrosive chemicals in the workplace, you have to have an eye wash station, and you have to inspect those on a weekly basis. Signage, correct posters, prevention plans. And then really when it comes to those needle sticks, prevention is key, but always make sure you've got a good post-exposure documentation readily available, because it's stressful for not only the employee, but for that person that's been designated at the practice to handle those types of reports. When it comes to HIPAA, it's the same thing, really putting those policies and procedures in place, making sure you have the correct authorizations. The key is also that patients have a right to access their information. So we want to make sure that you've got the proper forms to document when a patient requests information, their right to that access, a right to request amendments should they see an inaccuracy or an incorrection. Again, required training. And then security controls. There's a huge technical component of working with those third-party IT vendors to make sure that those safeguards are set up, put in place, that you have sanctions in place, and that you're meeting those. So again, we work really hard to create kind of a 30, 60, 90-day checklist for those startups so that it is not so overwhelming from the beginning. Yeah.
Yeah, spread it out a little bit, right?
Yeah, and I would be, failing you if I did not also mention, the foundation is so important to set up those policy and procedure manuals from the get-go, to sign off on those. But a one and done is not okay. An
Mhm.
annual review is critical. So even with some of the existing practices that come to us, they're like, yeah, we bought a manual from you guys. It's dated 2012. And yeah, it's not been touched since. That's not a policy and procedure manual. So
Yeah, yeah,
yeah, it's an ongoing review process to make sure that you're staying on top of those and any updates. So
yeah,
yeah, and
yeah. It's a
HIPAA is
live
starting to
document.
change. Yeah, and we've got a lot of proposed final rules in place that we expect over the next year that are really impacting practices. So yeah.
Okay. All right, last topic. Best practices and responses for incidents and audit. So I think let's kind of talk a little bit. I know you've already spread this out throughout, which is really good, but kind of what would be those best practices for a practice that's starting up, just kind of being aware of it more than anything.
Yeah, there's no question. You've got the privacy rule, you've got the security rule, you've got high trust, omnibus, enforcement, and the breach rule. So really just an awareness of what's included in each of those. When it comes to the breach reporting rule, knowing when something has to be reported, knowing what those thresholds are. Under 500 affected individuals has a very different reporting procedure than those over 500. But even when it has to be reported, whether it's within 30 days, 60 days, or at the end of a calendar year. So again, setting up those policies, being aware of what the rules and the regulations are, being aware of any type of updates or changes, and when those happen, documenting those in your practice and then filtering that training back down to your employees. That is, I would say, one of the most critical components for a
And,
successful compliance program.
and the owner of the practice is ultimately responsible. Do you find that they're mostly the security officer, or does the practice manager often be the security manager for,
So it's
for the
funny
practice?
with our startups, I work with the physician initially because they're trying to do a lot of that heavy lift anyway, and they're managing a lot of things themselves. But eventually, that is delegated, oftentimes to an office manager, practice manager. I'm even starting to see more HR managers
Mhm.
be delegated that role of privacy officer for the
I see.
practice. Yeah. I see that a lot from the OSHA side as well, because again,
Mhm.
it's that employee safety, it's that onboarding component. But yeah, you see it kind of across the board. You can split those tasks as well. Even having a clinical person handle the OSHA side and having more of an office administrator handle the HIPAA side. I've seen
Nice.
that be very successful.
Okay. Great. So what should they, kind of what should they be aware of? Kind of starting point. Obviously, there's going to be paperwork, and everybody's, good based on state rules as well. But let's kind of put it into perspective. If they did get an incident or audit, what should they be thinking about as they start up the practice?
Well, the goal, I think, for a startup practice is avoiding those situations. So, really starting off with a plan, with a checklist. And we've worked hard on our end to design the manuals and the kits to be very successive and very easy. They're really companion products that our manual is really meant as a resource for our practices.
Mhm.
I tell our practices, I don't create new information. I don't make this stuff up, but my goal is to take that overwhelming legal jargon and to simplify that for our medical and dental practices. Um, an example, OSHA has over 100 standards that are related to employee training. But when it comes to medical and dental practices, we're really looking at three major standards. So we want to make sure that you're focusing on what's important to you and that you're focusing on what's important for a medical and dental practice. And so, yeah, starting off with those policies that apply to you and then setting up a really good program, documenting that for staff, making sure things are accessible, that you're available should there be a concern. Sometimes an employee complaint turns into an OSHA complaint. So you want to creating a collaborative environment where you're working with them and let them know that you're there to protect them, minimize their exposure risks. And the same thing on a HIPAA side. Privacy officers, a lot of times I hear, I don't want to put my name on that notice of privacy practice. I don't want to put that on there for that patient to contact me. And I reinforce the idea that yes, you do, because not every patient complaint is a valid HIPAA breach either, but you want to have the opportunity to hear that complaint, address it internally if needed. And if it is a valid HIPAA breach, you want a chance to correct that before it affects another patient. So just really being aware of those and the responsibilities that go along with it, and really partnering with people that will support you to do that.
Yeah, great. All right. Perfect. All right. I think the big takeaways, if you're starting to practice or if you're in the process or thinking about it, is really creating that plan, being aware that you have to think about credentialing from the beginning. You have to think about OSHA and HIPAA all from the beginning. You want to stay compliant. Make sure you have your team in place, whether that's outsourced like to doctors management or other services, but really making sure that it goes along with your timeline. You don't want to get to the day where you open your practice and you're not credentialed, you don't have HIPAA training, and because on those days, the first day you open up, you're going to get an injury, you're going to get a breach all on the same day, right? So you want to be prepared, define your timeline ahead of time and work towards that timeline. I think the big thing I took away from credentialing, is definitely starting early, following up often, and then really, every state is a little bit different, but there are some federal overlying guidelines regarding OSHA and HIPAA. And before you open those doors, make sure you are compliant with all of them. So, Dawn and Shannon, was there anything else I missed in terms of kind of the overview of the topics? You guys did a wonderful job.
No, thank you so much for having us. I think we covered quite a bit. And again, it can be really
Yeah.
overwhelming and you have to just take it one step at a time.
Yeah. Yeah.
Yep.
Perfect. Well, for those of you who want, we have a workshop that we do again on a monthly basis. We have the webinar and we have a workshop all on the same topic. This month it'll be on June 24th. So you can go ahead and click through the link and register. We'll also send you out emails so you can register as well. We're going to have Shannon and Dawn back on our workshop, and you'll be able to ask them additional questions and following up from this procedure or this presentation. So. And this is our contact information. If you'd like to learn anything more about doctors management, how we can simplify the business of medicine, and how we can help you with starting up your practice, please feel free to reach out to us. Our solutions team can work with you, and maybe I'll be able to work with you during your startup. So thank you so much. I hope you guys all have a great rest of the day, and appreciate you. Talk to you soon.
Thank you.